everyone. Welcome to this weekly live. I am Dr. Mona, and I will be doing this live with Pediatric Associates, giving you updates on COVID. We are doing this once a week. Hello, welcome. We are doing this once a week while this pandemic is still going on. Right now, we decided to do this once a week because of how much information is always changing. We wanted this to be a place where you can come together with me. I'll be talking about the latest and greatest news in COVID, mainly how it deals with children, but I will also answer your questions on the most recent guidelines for what we know, right? Remember, this is an ever-evolving situation. I think most of us can agree that it's been pretty tiring, with things always changing, but that's what happens in a pandemic, right? We're always learning about the virus, we're learning about different variants, we're learning about the science behind the vaccines, the science behind masks. So we're always going to be making changes and recommendations to keep people safe, to keep people informed, and that's what we're doing here today. So thank you all for joining. I do kind of get started pretty soon because I like to go through as much as I can and have times for questions. So if you are joining late, you'll be able to watch this if you want to replay it later. We'll save it to our feed. So I am going, welcome. Yes, I love when you all wave and come in. I wish I could hear you and actually have you say your questions, but this is awesome and we're just so excited to do this. So like I said, I'm Dr. Mona. I am a pediatrician for Pediatric Associates. I work in the Fort Lauderdale area. So we are in the epicenter of where COVID is running rampant right now. Still, nothing's changed since last week. Nothing's changed since the week before. We are still in the epicenter. We are the state that has the most hospitalizations, the state where we're almost out of ICU beds. We're pretty much leading the pack in things that we do not want to be leading the pack in. Maybe you're joining me from Florida. Maybe you're joining me from somewhere outside of the state or outside of the country. You are learning about COVID. So I'm going to go over a few things like I always do. I'm going to talk about the current data that we have in terms of COVID in kids. And I always have to put a disclaimer that it's probably lower, the numbers that I'm saying, because a lot of states are not reporting data. So the numbers I'm saying are actually probably much less than what's actually happening. So we have to remember that. I'm going to talk about COVID updates and schools, what's happening with the mask debate, what we know, what should not be happening, what should be happening. I think if you're watching the news, it matches with what's actually happening in real life here that we'll go into. We're going to talk about the boosters for adults because people have had questions about that. Again, I don't have any information about the kid vaccines under 12. Right now, we still think that that's going to be under probably the 5 to 11-year-old group is probably going to be September, October that we'll probably get those, but that timeline can change. So that's what the tentative timeline is. And then you're going to actually be allowed to have a Q&A. So I do want to get started with all of, the information I have, and then you'll be able to answer questions. So like I always start, I'm starting with the data. So 4.4 million children have been confirmed positive with COVID since this pandemic began. 121,000 plus cases in the last week. That is up from 93,000 the week prior, which is up from 71,000 the week before that. So we are seeing an increase. Not surprising because we are seeing an increase in adults too. That's going to come hand in hand. Adults and kids are going to intermingle and spread this virus. Just kind of putting this in a frame of reference, the highest we've seen in children has been 211,000 cases, which was in January of this year when we had that second wave during the holidays. So this is putting things into perspective a little bit. But remember a big thing here. When I say this data, I want to say it with a little grain of salt here. We don't have data from all states because not all states are reporting. This is only 23 states reporting and New York City, which is a big population. So these numbers could be actually higher. Also, some states have stopped reporting hospitalizations. So we really need to understand what's actually happening on the ground, right? People need to remember, that's why we do this, because I'm a practicing pediatrician. My husband's an ER doc. We know what's going on right now, right? And then obviously the guidelines from the CDC and AAP are also taking everything into account as well. So in terms of the hospitalization rate, it's still at 0.9%. Again, I want to be very clear that we are still seeing kids hospitalized in Texas, Florida, all the southern states that have been doing, having these increasing cases. We are seeing increased admissions to the ICU. We are seeing increased admissions for children into the hospital. So although the mortality rate is still staying stable, we are still seeing hospitalizations. And remember, mortality is not the only indicator of concern, right? We obviously don't want children dying. That is a given. I think any parent can agree that if it's your child, 0.9% is still high. But we also want to remember that this is causing families to be in the hospital with their children. And we don't want children to be in the hospital if we don't have to, right? So we talk about reducing the risk. And we still don't know why certain kids are more likely in their health to be admitted than others, right? We are still seeing a high incidence of children of unvaccinated parents who are being hospitalized, or an unvaccinated person who's around them for like a long period of time. But a lot of these situations that we're seeing are unvaccinated individuals, but this can change, right? As the Delta variant becomes more rampant, we could see that vaccinated adults, their children, because their children are in a community. So it takes all of us to do our part so that we can stop spreading this to children, and that children can stop spreading it to each other. It's a contagious virus. We're gonna all spread it. So, playing these games of like, well, the kids don't spread it as much. They are spreading it, and we've seen this in the schools, which I'll get into, that they are spreading this virus, and we need to, things have changed a lot with Delta. So we really need to make sure precautions are in place so that we don't keep spreading this, that we can get out of this. In terms of when people have asked, well, when is this going to get better? Like, when can I say that this Delta variant is better? Remember, we have to look at things at a 2-week period, meaning right now, the positivity rate, and I have data for Florida because we're based here and most of our patient population is here, is 1 in 5. So 19.3% positivity rate. As a reminder, this means that for every 5 tests that people have, 1 in 5 of them have COVID. That is a high positivity rate. We want the positivity rate in a public health standpoint to be under 3 to 5%. That is really good mitigation efforts. So 19.3% is really high. So we want to get it down to 3 to 5. We don't know if that'll ever really happen, given this variant is so transmissible in this period, but that is the goal. The other thing is we want to see steady decline of cases. Right now, we are still seeing that climb go up, 71,000, 93,000, 121,000 in children. So until we see that start to plateau, then we'll hold our breath and say, maybe this is the plateau, maybe we'll see it come down, and then we wait, right? Right now, it keeps going up. So we still want to make sure that we're taking precaution while things are like this. And I said it last week, the goal here is to reduce risk and reduce spread of a disease, right? So masking in schools, masking in grocery stores, indoor masking, vaccination, all of these are layers to help protect our community, right? Because we don't want children to get sick, end up in the hospital. Maybe some of them will die. We don't want adults to end up in the hospital. Some of them will die. We don't want that, right? So we need to do things to help each other. And that's what this is all about. Remembering that in a pandemic, it's not just about you, it's about other people too. And nothing will remind you more of the selflessness of a human being than a pandemic. So in terms of masks in schools, if you are living in Florida, you know what's going on. I mean, there are tons of schools already having to close down classrooms, quarantining children and teachers because of the optional mask mandate. We knew that was a bad idea. I mean, I don't think any public health expert would have said that was smart to have masks optional in a school-age child. The reality is, so you've probably heard what's happening on the west side of Florida in Hillsborough County. So in Hillsborough County, there was about 10,394 students and 338 teachers are isolated or in quarantine right now. Isolation meaning they have COVID or they are in quarantine because they were exposed to COVID. And this was because of mask optional rules. There's no way around this. It was because of that. How do we know? Because it's not happening in places that have mask mandates. Remember, kids are not vaccinated, right? Your under 12 crowd is not vaccinated. So the only protection they have to reduce spread or reduce the chances of getting this is masking or the people around them who are eligible to get a vaccine to be vaccinated. We do this to help protect the people who aren't eligible yet for a vaccine. That is what this is all about. So again, we don't have swipe ups yet. We're hopefully close to 10,000, so I can start adding swipe ups after this live. So share, get us to 10,000. But I am going to attach a screenshot of an article that you can read from the University of Alabama talking about the effectiveness of masks. I mean, we have seen this, that it's effective. So to argue that they're not effective is not true. They are effective. They are helping reduce transmission. And in this article, they talk about reducing transmission by 70%. So remember, it's layers of protection. And when our children don't have vaccination opportunity under 12, we need to add this layer of protection to help each other, right? And it's not just about, I don't want my kid to get, people will say, well, I'll just take my chances. I'll get sick, they'll get sick. Their immune system will fight it. It's also about that your kid will have to stay home for 10 days. If another kid gets it, the school shuts down for 10 days. There's rules here because this is a contagious virus. So your kid is now going to be at home when they could be in school if we had mask mandates. So it really comes down to, if we just did the right thing and masked our children, which they can still have their lives, they can still learn language, they can still see emotions, they can still do everything. Especially when we're talking school-age kids, 5+, the kids who are in school right now, they can do everything. They're able to. So now you want them to be in school. Our goal is for every child of every ability to have an opportunity to be in school with their peers. I mean, this is what our goal should be. And every pediatrician should want that same goal, that we want our kids to be together. That is what I think everyone wants. But the reality is, in a pandemic, there has to be some mitigation efforts. And for that, it means masking our children. And, there is still a lot of debates happening. Well, I don't want a mask. It's a right. It's a piece of fabric. We've talked about this. It's not infringing on a right. You can do the comparison that schools have dress code guidelines. There can be a guideline to have a mask on your face in this period. If Delta gets better, January comes along, kids are vaccinated, we see spread reduce, we may not have to have it. But the longer we keep pushing this and fighting it, the longer we're going to have to keep these masks on. So if you want this to be over, we have to do what we need to do to get out of this. So there's really no way around it. I mean, it's a public health emergency. So please remember that you have to do your part. And if you have an issue with, I don't want to wear a mask, I don't want my children to wear a mask, think about the big picture here. We're going to prolong this. This virus is going to keep circulating. You're going to keep fighting this fight, when in reality, wearing the mask, vaccinating if you're able, will help protect everyone. And this is what our goal is to protect as many lives as we can. We don't want this virus to get to someone who's not going to be able to fight it. And it's not us to say, well, I can fight it. I trust my immune system. How do you know? Your immune system hasn't seen COVID before. So you don't want to take that chance. So this is not just about I'm going to take my chances. This is a new virus, and we want to reduce risk for our families, for our children, for our grandparents, everyone. It's really important. I am going to get to questions in just a bit, but I want to talk about the booster. Right now, it's not obviously child related, but I do think people have been asking. The booster is now recommended as of now for anyone who's immunocompromised. So solid tumor malignancy, organ transplant, stem cell transplants, HIV infection, high dose steroid treatments. Obviously, as an adult, you would know, you should talk to your doctor, but you are eligible right now. Starting September 20th, all people 8 months after their second dose should be getting the vaccine, third booster. And people have asked, well, what does this mean? Does this mean that we're going to have to get yearly, every 8-month vaccines? We don't know. So this could be one of two situations. It could be a flu situation where we get seasonal, or it could be a situation like with our children, how they get boosters for your tetanus and pertussis, and you get boosters for your meningitis, the Hib meningitis. It could be that we just need 3. We don't know until we see what's happening with the study participants, see what's happening. So we kind of have to be patient, which I know it's really hard to do, but the data will show us what needs to happen. Is waning immunity happening? Are there new variants? Is the current vaccines we have effective, or do we need to provide boosters? So this is how vaccination research works. It looks at what is the virus that we're trying to fight, what is happening with that vaccine, when is immunity starting to wane, and that is why they made these recommendations, because what they were finding is that they were still seeing that the adults were having a reduced risk of hospitalization and severe disease. 95% was with the original strain, like the vaccine that we have, 92% against Delta. So it's very effective against hospitalization and death. But what they were seeing, more breakthrough infections, right? Delta is a different beast. So it's about understanding the science and respecting that, hey, we want people to be protected. This means that if there is an immunity decrease, that now we're seeing this fall to, you were at 75% and now you're at 40%. We don't want that. We need to we need to provide a booster so that adults can be protected as well. And so time will tell whether this is going to be a third and final dose. It won't ever need to happen again, or if there's going to be a seasonal need. So we'll stay up to date on that, but that's just kind of what's happening right now with the boosters. But again, all my questions I'll kind of gear towards pediatric stuff, but I've been getting questions about that. In terms of Breakthrough infections, I spoke about that. Yes, they are happening. We're thinking that they're happening more than we're realizing, mainly because of the variant. The Delta variant has really changed everything. And remember, it's not a faulty vaccine for it not to protect against variants. A vaccine will protect against the strain it was created for, right? But it's likely to be protective against variants, but you can't 100% guarantee that. No vaccine can ever guarantee that. So now they are looking at trends and they make the decisions based on that. And it's for our best interest, right? We want to protect ourselves and each other. And that is why the 8-month rule came out, because of increasing breakthrough, because of the Delta variant. And this is something that, obviously I would recommend. My husband and I got ours more than 8 months ago. So we'll be getting ours in September 20th week. The last thing I want you to remember is the importance of masking and vaccinating, okay? We are doing this as mitigation efforts, meaning layers of protection, and we're doing it to protect against people who are not able to get vaccinated, meaning we're talking about people who truly medically are unable to get it, an allergy to the vaccine, children who are not able to mask, right? We have younger children than 2. We have some 2-year-olds, 3-year-olds that can't mask. And then we also have children who are like neuroatypical, which means like on the autism spectrum that can't mask. So we need to protect the children and people who are not able to be masked by vaccinating ourselves, by masking ourselves, and we need to. These are all important things to consider. So let's go back up, and I'm gonna answer questions for about 40 minutes, or until we run out, okay? So, is the vaccine safe while breastfeeding? Yes. Now, every major organization, the AAP, ACOG, which is your obstetrics gynecology, the American Academy of Lactation Medicine, all agree that it is safe to get while breastfeeding. It is safe to get during pregnancy. This is now coming out from data of people who have been breastfeeding, people who have been pregnant, that are showing safety and efficacy. So yes, from a personal standpoint, we are seeing a lot more pregnant people get COVID. A lot of them are being admitted, and it's a concern. A lot of them, it's similar to when a pregnant woman gets flu. We are seeing a lot of issues with that, okay? A lot of issues with pregnant people getting COVID. So we want to protect people with the vaccine. Hello, yes, everyone, waves. My school requires masks, but no more distancing. Claims CDC says masks replace distancing. So that's not true. It's not a replacement. It is about a big picture here, though, right? I am so grateful that there's masking. I wonder if maybe it's a public school or whatnot. I know there's resources issues where maybe they're not able to spread out. Obviously, the ideal situation from the CDC would also be vaccination, masking, ventilation, opening up windows to let air circulate so it's not all stagnant, and distancing, right? Keeping desks apart. Now, in the reality that we can't accomplish that, we try to do the best we can, which is vaccinating, masking, ventilation strategies. So I don't consider that a huge red flag. I'm very grateful that masking is happening, and that is something we need to happen in schools right now, given what we're seeing with Delta. And like I said, maybe that'll change in 4 months, 5 months, but we can't do that right now in terms of taking off those masks. So I would support that, but understand the kind of guidelines and what schools need to do in a practical sense. I love you, waves. Are the copper compression 4-layer masks good, or are surgical or K95 better for kids? So surgical, like the surgical ones, that are the most important thing is it's a mask that your child will wear and that it's not falling off their nose, right? Because a lot of masks are loose for kids. So you can actually like tie the loops if you need to, like tie them around and put them around the ear. KN95s are great. That is a very great mask. That is something that, we used as adults, and you can also get those in children's sizes online. I do know like Amazon and other websites have them right now. But yes, KN95, if you don't have access to one, any mask that fits your child and that they will wear is a good mask, right? We want to focus on maybe, yes, good practices, but also I want them to wear it. So if it's something cute and they like it, they can have that one, right? Ideal fit would be not like loose where it's falling off the nasal bridge. Ideally would be a wire here that keeps it down on the nose. But remember, the goal here is that they keep it on, especially if you have a younger child. Let's see. I'm just scrolling to see questions. Are there heightened concerns if my child has sickle cell traits with COVID? So sickle cell trait and sickle cell disease for children was not listed as a major issue, but like I will say, there still needs to be way more information for kids. It's lagging, okay? So I treat it like sickle cell trait, no, but sickle cell disease. With sickle cell disease, any fever would be, over 102.5 is considered a concern. If you have sickle cell disease. Sickle cell trait, it's like how you would manage any other virus, but I still would recommend vaccinating your child regardless, when they're eligible, but not any heightened concern for the trait. For the disease, yes, because of the fact that fever can be a concern for sickle cell disease, for sending them into if you're learning about sickle cell disease, sending them into a pain crisis is common when they get ill. So we want to make sure that doesn't happen with the disease, not the trait. My brother-in-law vaccinated, wants to visit from New York City to see my 5-year-old. Should we postpone visit given Delta? So I'm going to tell you kind of just some things to consider. There is a chance, right, that there could be some breakthrough infection, right? I thinking about if that brother is vaccinated and active in the community, that's fine. He's a brother and he's able to. You're vaccinated. That's awesome. But thinking about that, if your 5-year-old is not vaccinated, if that 5-year-old is higher risk for any reason, some sort of medical condition, maybe considering no. Now, if there is no risk factor, you can decide. There's no clear-cut guideline on this. Remember that if he is traveling and he has any symptoms of any kind, then you should probably hold off on visiting. If there's no symptoms, I would practice good hand hygiene. And if there is symptoms, you should either hold on that visit, or decide maybe wearing a mask just to protect any sort of chance that this could be COVID. But it's up to you to decide. I really do, for vaccinated individuals right now, the travel recommendations are still there that you can travel, but they have not updated the guidelines with breakthrough infections yet. So I'm just thinking more of precautionary, thinking about risk and benefit. If that person is well, no sore throat, no runny nose, nothing, right? Fine. But if he's at all feeling under the weather, then there's a chance that there could be a breakthrough, right? Breakthrough infection can be in adults can be fever, cough, but it can also be just a runny nose and sore throat. So kind of understanding that and talking to your partner, talking to your brother, seeing what you guys are on the same page about. But it's not an immediate, you have to cancel. It's really just looking at your personal situation. Perfect. Should we sanitize with Lysol or disinfectant backpacks and anything coming back and forth to school? I really want you to just focus on hand hygiene for your child. At this point, there's no recommendation to sanitize. If it makes you feel better, you can, but there's no at all. Even from the beginning of the pandemic, we don't have updates on Delta, but we know that it is a respiratory virus, not fomite. Fomite is if it lives on surfaces. So that being said, we don't know about Delta. So I would say focus on hand hygiene for your children. Maybe have a designated area for the backpacks, maybe on a hook in the garage or by the door, so it's out of the way where they're touching it all the time. Maybe just let it air out or something there. Just keeping it away from everything else, not putting it on their bed or something like that. Just a basic kind of hygiene thing, but you don't need to sanitize. This is a great question. I want to repeat it, and then I want to explain what. Is there a recommended amount of time between COVID dose and flu vaccine, or is the need for spacing a thing of the past? Right now, they have not updated any guidelines to say that you have to space it out. So the recommendation right now, and I would agree, is that you can do them close together if you needed to, right? I don't know if they'll come out with guidelines, but they've said that for all other vaccines, and they have not made a different thing about flu. And that is going to happen, right? Great question, because the boosters are going to happen September 20th and beyond. So you're going to calculate 8 months after your second dose, and then it might coincide with the flu vaccine. So you can decide what you do. I probably am going to get it on separate days just because out of preference, but I'm not going to wait 21 days. I'm just going to do it one day of COVID, one day flu. That's just a personal preference for me, but you can decide what you want to do. But I wouldn't delay like a month because you don't want to get the flu. And I don't know what kind of flu season it's going to be, and we don't want that. So don't delay it. There's just no guidelines right now. The reason why I am choosing to separate it is that I know with the COVID vaccine, I get like body ache and myalgias, and I just want to keep that, give time for my body for one vaccine, which is why I'm choosing to separate, because the flu can also do something similar, right? You can get a little soreness. So that's why, just a personal choice, but I will get both. Is it safe to do PE wearing a mask? My child has been wearing masks all the time in school, but PE time was especially hard. So it depends on if they're outside or inside. So outside, if they're, outside, if they're, like if they're doing like running around the track or something like that, they're not around too many other children, you can take that off. But inside, I would recommend it. When you say, is it safe? They can breathe. I work out with the mask on at my gym, and kids can breathe too. Over 2, we're not worried that their airways are too small or anything like that, so they can breathe. And so if your child, if you have a concern that you're worried your child is getting short of breath or anything with the mask, talk to the PE teacher, but there's no reason why they can't wear one when they're working out, especially in an indoor setting. The reason why I'm saying outdoor, and I'm just speaking from personal, I know how it is. It's 95 degrees right now. I don't expect a child to want to keep a mask on outside when they're running, but I want us to try, right? We should try if they're around other children and if that's the rule, but you can't force it on them, right? You can't force the mask outside when it's so hot, but we try our best, right? We have to try our best. And indoors, I would definitely wear it. Where there's more air conditioning and stuff, there's no reason. But from a comfort level, like when it's hot and you have, it could be harder not to breathe, but just discomfort, Can kids, is the hospital rate for kids staying at the same percentage per infections, or is that percentage growing? So what we are seeing is that children are now taking a higher share of COVID hospitalizations in general. What I mean is that at some point in the pandemic, it was like 1% of all COVID hospitalizations were children. Now 2.5% of all COVID hospitalizations are children, right? So there is an increased share of COVID hospitalizations being kids. The number I was saying about the 0.9%, that is of all COVID cases in kids, 0.9% were being, the 0.9% were being hospitalized. So that is, I hate talking about those numbers though, because I think it's nice to get a frame of reference, but not all states are reporting hospitalization. So I imagine that number to be truly higher because one of the states not reporting is Florida, and our hospitals in this area are getting filled with COVID patients for kids. And a lot of them are getting admitted for pneumonia, so COVID pneumonia and dehydration, similar to any virus, and some of them are in the ICU for MIS-C, which is that inflammatory condition, or difficulty breathing pneumonia that needs intubation. So that is what we're seeing in the ICUs right now on the pediatric floors in South Florida, Broward, Miami-Dade, and also this is what's happening all over the country with what the children are being admitted for. And I understand the data is lagging. When I say the data is lagging, is that it's not always like we get this and then the next day they have all this data. Data takes a long time to collect, and that can be really hard for me when I'm trying to get this information as a parent. You're trying to figure out, well, what's the risk? What do we do? So when we're still in this frame of trying to figure out what to do, we want to be cautious. And I know sometimes it gets tiring of being cautious. Like we're just like, oh my gosh, I've been cautious for 18 months. But it's not about not doing anything in our lives. Like I've said over and over in these lives, it's about doing everything with risk reduction in mind. What can I do to just reduce the risk for my family, right? For my child, for my peers. That's what it's about. I don't need us to stay indoors all day. I've never said that the entire pandemic, but we need to figure out, well, what can we do just so that we can protect ourselves as much as possible? I'm just rolling down. A lot of these are repetitive questions. Does asthma make a person more likely to get severe COVID? So asthma, actually there was a study for adults that there was no increase, like this was actually months ago. So again, I have to say it's not updated for Delta. So that's why I don't want to say it fully. So I would take precaution given the fact that we don't know. Whenever we don't know something, it's always better to err on the side of caution until we know, is my opinion. It's up to you if you feel like I want to take my chances, but in my opinion, we don't know. So I would just obviously just take your same precautions that you would in terms of masking vaccinated individuals around the person with asthma if they're not eligible to get a vaccine. But if they're over 12, they're eligible to get one. Would you send your son to school if he was in elementary? This is a great question. Again, this is a personal question. I'm happy to answer. I would want my child to be in a mask mandated school. That is what I would want. My son is younger. He is a toddler that is not age of wearing masks yet because he's not 2 yet. I do send him to school where the other toddlers are not masked and the teachers are vaccinated, so they do not mask. So that is the rule that we have, and I'm okay with it since the teachers are vaccinated. But remember, the rule is masking, right? If my son was older and he was in school, I would want him to be in a masked school. Now, it's a what if situation. If a lot of people were wearing masks, then I would I would be fine with it. But I just don't know because it depends on where we would have been at if I had a child. But my concern is this is spreading when we don't have masks on, especially with all the Hillsborough County cases that we saw. Palm Beach County has a lot of closures. Thankfully, Miami-Dade is taking note and they are instituting, when they start school, mask mandate for everyone. I mean, this is the smartest thing we can do. It's just a simple thing so that we don't see this go unchecked. And I'm very proud of Miami-Dade. Broward also had it, but there were some schools falling through the cracks with you can decide. There really needs to be a uniform decision here so that we can better track situations. We know what's going on. We can get out of this mess. I don't want to be in it either. If we just mask and vax, we can get out of it. I'm telling you, it'll happen. Eventually, we're not going to be in this, but we got to do our part. Our schools aren't requiring quarantine because masks are required. Is this a safe idea? Again, the hard part about this is that there are no official guidelines to say that is okay. I do feel like if there are masking requirements, that does help in terms of reducing spread. I do feel, though, that if a child does have a fever and cough, even if there is masking requirement, that they had an exposure to COVID outside of the home, because you can get COVID from outside of school, remember, right? So I do think they should be tested, and I do think that they should have to quarantine or isolate, right? If they were exposed, if we're thinking it outside of the school. Now, in the school setting, if they make a policy that if there was a COVID exposure in the school because of masking, that's fine. That is okay, because when you look at the CDC guidelines do say that an exposure is if you're in 6 feet of an individual for more than 15 minutes unmasked. That is when you are considered an exposure. So in this situation, that would make sense that you are not considered an exposure, but they have not updated the guidelines for Delta. And that's what I want to be very honest about. And I wish they would update those quarantine guidelines and testing guidelines, because we know Delta is more contagious. So is it 5 minutes of exposure? Is it 20 minutes? Obviously it's going to be less because Delta is more contagious, but that's kind of what the nuance there is, that they have not updated the guidelines. And I don't want us to get frustrated, because I know it can be. It takes a while to update guidelines. There's a lot of people that have to make decisions. It's like they meet every few weeks to make these decisions, and it can be like we're kind of playing these waiting games. But I'm kind of trying to help you put the pieces together of what we know now. But I would remember that you could still get COVID in the community when you're at home or, it's not masked. So if they are exposed or if they have a fever and a cough, they should get tested. COVID can look so differently in children. We know that some children can be asymptomatic, some can just have a sniffle, some can be fever and cough, and some are admitted to the hospital, and we still don't know why, okay? That a child who's very healthy and looks healthy and parents are think that they're healthy could get serious COVID. We just don't know right now, right? So we really do want to take those precautions and understand, what we can do in terms of testing if we need to, because testing would be fever, cough for sure, and then testing would be if you were exposed to someone with COVID, or following the guidance from your school, like if the school requires testing. What vitamins should I be giving my child in preschool? So there is no official vitamin that's going to be that vitamin, okay? Everyone is going to say something and everyone has opinions, but there's no science to support it. Now, that being said, even though there's no science to support it, you can obviously always choose to give them food that's healthy. That's the best thing we can do. I always talk about things that grow in the earth, like plants. Plants and so vegetables, fruits, whole grains. So fiber and vegetables and fruits are really great for our immune system, like I said last week, because our gut houses a lot of our immune cells. So we want to treat our gut right. And fiber, vegetables, and fruit are really good for our gut. Probiotic yogurt, probiotics in general. But if you want to do a multivitamin, you can. But I don't want you to pump multivitamins into your child thinking that that's going to be what keeps them from getting sick. That's not how it works. Immunity is so much more than a vitamin. So it won't hurt to take it as long as you take it as prescribed, meaning on the bottle. But remember, it's better to look at the foods that we're eating over anything else. And if your child is, obviously if you have a child who's a baby, like an infant, immunocompromised child, please run any supplements by your doctor, because we need to make sure, well, is there any interaction with anything that child's taking, the age, the prematurity of a baby? You don't want to just dump supplements into a child because they're not also regulated, right? The supplement industry, multivitamins, all that, we really are just trusting the companies that they're saying that there's stuff in it and that it's safe and efficacious. So we want to be very cautious because there's no checks and balances on those products. So it's really on your kind of own judgment and risk of like saying, you know what, I'll do it. But I don't need you to. You can always speak to your clinician on personal guidance if you're concerned. So even though there is a mask mandate, lunchtime is an issue. Kids are less than 6 feet apart without masks. How can we keep our kids safe? I don't know what they're doing, and maybe someone at the end can answer me. Are they doing little pods? I don't have a school age. I'll ask one of my colleagues who has school age children. I'm curious. My idea here is that we want them to be masked as much as possible, but at lunch, obviously they're eating. So my goal is, are they kind of in separation? Like, do they have little groups at different tables? Because that's going to reduce risk. Did they open up the windows so that there's ventilation? Because that's going to reduce risk. So again, it's not an automatic they're going to get COVID situation. It's like, what are they doing to reduce risk? Now, if children are all stacked on top of each other, yelling at each other, you know how kids do, like happily yelling, then I'm like, well, what are we doing here? But if they have kind of created little groups and pods and, they've kind of separated kids out, then I think it's fine. But we do the best we can. And I know schools are struggling big time. I mean, they're trying. I hope they're trying, but I've heard a lot of my schools in our area are trying really hard to do what they can to keep teachers safe and keep the kids safe with the mask mandates. That's important. How at risk is my infant baby? She's almost 2 months. I get nervous taking her anywhere. I think it is, let's see, sorry, someone asked about the vitamins, and everyone's asking me to answer the vitamin question, so good, okay. Sorry, how at risk is my infant baby? So we do know that infants under 1 are considered high risk because they're babies. Their immune system is much weaker in terms of being able to fight an infection, but that goes for any infection. RSV, flu, we know this, right? The younger we are, the more concerned we are if a child gets sick. So using that frame of reference, to me, it would be treating how we would treat any viral season, right? With the understanding that we still want to take precautions just to reduce the risk of spreading this new virus to, COVID is considered new still for kids. So you don't have to stay at home. You can go for walks. You can go for walks in your neighborhood. You don't have to isolate yourself inside. But I would think about maybe avoiding, at this point, crowded places. That includes places that are indoor, poor ventilation. So if you must go to the grocery store because you have no option, remember, that is a necessity. Does that make sense? Like, we got to think about what we need to do versus what do we not need to do. Grocery store is an essential errand. If you have no one to watch your baby and you need groceries, you have to take your baby. There's no way around it. So I don't want parents to feel like bad because you have to do what you need to do. Maybe go in the morning, right? First thing in the morning or in the evening, like maybe after like 7 p.m. if the baby's awake. But you want to go maybe in the morning so that you're reducing how many people are there. That's one idea. You want to really think about avoiding indoor crowded places like churches, temples, places of worship are where a lot of people are together indoors. Many times they're unmasked, they're singing, they're talking. That is risky for germ spread. So you want to think about outdoor activities. You want to think of indoor places that have masking requirements for more of the adults, or going to places at non-crowded times. But I don't think you need to sit home all day. You need to get out. So it's okay to go for walks. I know it's super hot right now. So if you need to go for a stroll, in the evening, obviously that's fine. But really deciding to go to indoor places that are a necessity would be best. A lot of the eating stuff. I'm really curious if, What about booster if you got J&J? Can you still get Pfizer? So right now they're still asking to stick to the same vaccine. J&J was approved March of 2021. So the reason why they didn't talk about J&J in the update is that those people are still not eligible. So they would be eligible in like October, November. So that is why. I'm sure they will also get the 8-month rule, but we have to see what's happening with that. But the reason Pfizer and Moderna, remember they were approved about a couple weeks from each other, like 2 to 4 weeks from each other, which is why they got that recommendation. So J&J right now, there's no recommendation, but that's because it got approved much later than the other two. I never got a response. Okay, if my adolescent child gets COVID, do they still need vaccine? And is it true that they need to wait 90 days? So no, they do not need to wait 90 days. They should still get the vaccine 100% because the vaccine is going to provide them more immunity against variants, against getting this again. The only time you have to wait 90 days is if the child got immunotherapies, like in the hospital, if the child was admitted and got certain therapies, antibodies, things like that, then we have to wait 90 days. Otherwise, you do not have to wait 90 days. Should we be getting booster at 6 months? So it's 8 months from the second dose, and I would get the booster. Remember, so how the immunologists are explaining this is the first two were basically setting up the stage. They were the first two that were 21 days apart. They were setting up the stage where they basically were neutralizing the antibodies of the virus, creating like that foundation, like almost like getting all the guards ready, creating the immunity. And now this third one, the idea is that it's going to give that boost to really provide protection forever. That is the idea, but we don't know what's going to happen if that'll be the case. But that is kind of what a lot of the immunologists are explaining right now, is that the first two worked and they needed to help neutralize everything. We needed to make sure that people were protected. And now this third one will hopefully, we don't know, be the one that helps stop this, right? Because what will happen is that now we'll have the increased immunity. It'll help protect against more variants. You'll have better immunity against all of the variants now. And so that'll be helping us for sure. But we have to see. Everything is always changing. What kind of ventilation? So ventilation is such a big word, but it really for me is, I don't want it to be stagnant air where people cough and it just mixes. So I'm talking like opening windows, opening doors. Any door and window we can open is to me a good ventilation system. That CDC just talks about ventilation strategies, which means circulating air, right? Obviously schools don't have like HEPA filtration, things like that. So that would be ideal, but we don't have that. So it's opening windows and opening doors. Is Delta causing more severe disease in kids? I'll do a few more, okay? Is Delta causing more severe disease in kids? So I can't answer that fully because we are seeing that more children are being hospitalized, that subsequently we are seeing more children intubated in the ICU. And that could be because of the fact that Delta is more contagious, not the fact that it's more severe. Does that make sense? Like, meaning it's the fact that more children are getting this now. So we're just seeing more hospitalizations because it's just more contagious. So there's nothing to say at this point on August 19th that it is more severe in that children are getting more severe outcomes. But like I've always said, we don't know yet because we are still so new in this Delta variant for kids. And this is a different ballgame I've mentioned. This is not like your mother's COVID that we saw last year or in January. This is hitting different, meaning it's more contagious. We've been kind of watching this for months. And yeah, kids are getting it. But I will keep you updated on if any things are indicating that children are having worsening symptoms, things like that, but nothing is saying that it's pointing towards severe disease. But we still want to take precautions because we don't want it to become like that, right? And that's why I'm saying when you don't know, when there's no data right now, you just want to err on the side of caution because until we know more. These are such great questions, everyone. I'm in Texas and my son just started kindergarten and I'm terrified. No masks. I'm ready to pull him out. Look, these are hard choices and I can't tell you what to do because every situation is different. I will say that what's happening in Texas is very alarming to a lot of pediatricians, and I'm assuming even there, in that there's no masking and there's no quarantining and there's no rules at all. And that's tough for us, because again, chances are, we know this when we talk about numbers, that your kid could get this and have a good outcome, but we just don't want to take that risk. And masking and all of that would be that risk reduction. It is a personal choice to decide. I don't think that's fair because I think they weren't even offering a homeschool virtual option, which is so defeating. I can't speak to that, but I will say that I really support whatever you do, and I know how hard that must be to make these choices, and I wish I had more clear cut do this or do that, but I just don't know what resources are, right? Like, I would love if a family can pull their kid out if there's no mask mandate and know that, but I also know not everyone can do that. So then we have to say, well, I want my child to be in school. I'm going to do the best I can in terms of vaccinating myself. You could still put your child in a mask. Are they not? They should at least allow your child to wear a mask even if there's no mask mandate. But you can do those things to reduce the risk if homeschooling is not an option, right? We have to think about our resources. We have to think about, we got to do what's best for our situation, right? And sometimes that means having to make tough choices. And I don't want us to feel guilty. I know it's hard, but if your child were to get COVID and you did all you can, you did everything you could. This is an invisible enemy. We can't control every aspect of our lives with COVID. It's impossible, but we do the best that we can with the resources we have and the information we have, right? So I know how hard that must be. I made those same choices with my son for daycare or his school. I'm asking this and that, what about this? And it's tough. It weighs on you as a parent. So I'm so sorry that you're making those choices. And I hope you make the right one for you and that you feel supported by your partner or loved one, because it's hard. And I hope it's more clear. And I hope the states and public health systems come to understanding of how important this is. It's so important that we look out for our children. And now the governor has COVID and it's like, oh my God, like what's going on? Like it's so much. These were great guys. Let's see. Why won't CDC mandate masking so school districts can't make masks optional? I talked to the AAP about it. It's because we live in America and states have their own rights and individuals have their rights. So there's no ability to make a mandate. So we have to go on the goodness of people's hearts to do the right thing. And as we've seen in America, that's not working. So it's a tragedy. There's no power in the sense that they can say the recommendation, but the local governments have their choices of what they want to do. And then even more so, the local entities have freedom. And it's not right in a public health emergency. There has to be some guidelines. There really does. It has to be uniform because this virus doesn't care where you live. It's going to circulate. KF94 is great for younger kids. Yes, that's another type of mask. I agree. Do you think they will result back to virtual school due to spike? I think right now they won't because they just don't have that set up. I think if it continues where the kids are being quarantined 10 days, then they're going to have to come up with the virtual school option. But if people wore masks, we may not have to see that, right? So it really comes down to what's happening in each school. These were all great questions. I'm just going to scroll a little down. Oh my gosh, you guys, so many questions. I am just so grateful for you all to ask. Yeah. I'm fed up with Texas. I'm so sorry. I'm really sorry. Oh, I brought tear to your eyes. Oh, I'm so sorry. I'm happy that they were hopefully happy tears of support. It's really hard right now. I do want to take the last 11 minutes to do one of my feel good, we got this situation, because I know, I use these sessions not only to educate you all, but just to really help remember, what we're doing here. Remember, if you're joining me, you probably are concerned about your child, you're concerned about COVID, and you're doing your best. And I really want to reiterate that you are doing your best, right? It is about that. It's trying to do the best for our families. And like I said before, for each other too. This is a public health crisis. It's not just about us anymore. It really means looking out for our community. And it means sometimes doing the selfless thing, which means maybe I don't need to do this activity, right? And unfortunately, not everyone is completely selfless. And I know that's hard. We can't force that on people. That's something that you have to have in your heart. And it's been hard as a pediatrician just to see what's been happening with the lack of selflessness, in a public health crisis. We, as pediatricians, we are very selfless in how we, as a parent and as someone who takes care of children for a living, you'd give so much to a child. Your job is to protect them. Your job is to understand that you are going to do so much for a person who's not capable of doing it for themselves. So in that mindset, it's really hard as a pediatrician to see people not do that same service to each other, right? That same sort of, hey, I care about you and I don't even know you and I care about you. And that's something that I really hope we can spread more of. I feel like it's a little late now, but maybe spread that goodness, do your part. Be nice to people when they're not being nice to you. I know it's really hard sometimes to be kind when kindness is not deserved, but remember your kindness is really good for the energy in the world. I know this sounds very kumbaya-y, but remember it does help. We were in a very hard time. I was at Publix the other day and the lady was yelling at the person and I was like, that lady's probably having a bad day. So I went up after and, I said, hey, you're doing an amazing job. Like, you need to be nice to people. Like, everyone's struggling. Everyone's going through something. You really need to remember that we're all in this together and we're going to be here next week to answer more questions. I will I'll try to leave more Q&A. I'll try to keep the intro brief, but if you found this useful, make sure to share it on your page so we can get to 10,000. I'm going to answer this last question. When is the vaccine going to be available? September, end of September, October is the timeline right now for 5 to 11. And then for 2 to 5 or 2 to 4 and 6 months to 2, likely going to be in December. Thank you so much. I'm going to save this and we'll be back next week and try to get us to 10,000 so I can start adding the swipe ups because it'll be so much better and we'll put a highlight together and then you have the resources so you're not like, where is this coming from? Because I do research all of this heavily and I have data to support it. So really, really great. Nice to see you all and I'll save this for you for later.